Hello to you all. We would like to speak today about trauma, whereby trauma is something that takes us over many events. So let's take it from the top and introduce the position of it. Trauma is really an emotional response to a very distressing event or series of events that physically or emotionally are harmful to us or life threatening and has lasting adverse effects on a person's well being. It can include experiences such as abuse, accidents, natural disasters, or even war. And the effects can manifest as long term negative effects on our mental or our physical health, behavior, social functioning. Trauma can also result from witnessing or learning about a traumatic event that happened to a close member of family or a friend, such as death, a terrible accident or illness. So, what are the key aspects of trauma? First of all, on a physiological level, a disturbing experience that can have long lasting negative effects on a person's attitude and behavior. It can cause a loss of the sense of security. On a physical level, can also refer to physical wound, or injury to living tissue caused by an external force. Subjectively, what one experiences as trauma may not be so for somebody else. So it is a personal and individual response to an event. Does it have a lasting effect? Yes, it does. Trauma can have very lasting effects and diverse effects on the individual's functioning, their mental health, physical, social, emotional, or even spiritual well being. These effects can be long lasting and require professional support and recovery. Examples: traumatic effects or events can include a wide range of experiences such as abuse, natural disasters, war, quite a few going around, serious accidents. Natural events will be hurricanes, such as in Jamaica, level 5, Lisa, number 5, or earthquakes, or typhoons, etc., a death of a loved one, or serious illness. Excuse me. Symptoms. Emotional responses can include fear, sadness, and even anger, while behavioral symptoms can include re experiencing the event through flashbacks or nightmares, avoidance of reminders, and heightened arousal or even anxiety. So, what would be the normal responses in a nutshell for trauma? There are four: fight, flight, freeze, and fawn. Four F's. These are unconscious survival instincts that activate in response to a perceived threat. Again, these are unconscious survival instincts that activate in reaction or in response to perceived threat. A different, right? So, how would we actually understand these four? Trauma responses are fight. What is fight? Fight is reacting to a threat with aggression or being defensive or snappy or a need for control. Flight, avoiding situations that feel unsafe, often leading to anxiety or panic. And sometimes people relate to thrills or all kind of addictions. You name them, that's on the list. That's a big one. Freeze, the person becomes stuck or paralyzed in the face of danger, excuse me, unable to act. And fawn, Fawn, is appeasing, people pleasing, to avoid conflict, sometimes at the expense of personal boundaries. So you either freeze, you don't know what to do, or you try to please people by compromising on boundaries, or you become snappy with anger, or you can also be in the face of flight, which means running away into the comfort zone, into addictions, into anywhere that feels safe, just to avoid the panic or the anxiety of the actual situation. Now, we must realize that all these occurrences are completely subjective. In other words, one person must be a real fighter and doesn't take to heart at all, and somebody else will really take to heart and will go through any one of these four or all of the above in the face of trauma. So, how do we actually heal trauma? Healing trauma involves professional therapy. Just like a person, even if he's a dentist, cannot treat his own teeth, especially not root canal. Also, with dealing with trauma, one cannot do it yourself. It's not a do it yourself kind of therapy. One has to seek for professional help, such as CBT, which is cognitive behavioral therapy, understanding to the depth what a person went through. Or one can go to psychotherapy, NLP, which is neuro linguistic programming, hypnotherapy, psychology, to process memories alongside building a support system and practicing self care like mindfulness, physical activity, somatic breathing, and creative expressions to manage symptoms and regain a sense of security. The healing process is very much individualized and often begin with stabilizing the body before the mind, using techniques to calm the nervous system and reconnect with your physical self. So, therefore, one must seek out for professional help. Any of the above that I mentioned, psychotherapy, I especially enjoy psychotherapy and giving this to my patients because psychotherapy goes a long way in a short time and really create an irreversible program in the journey towards healing. So the patient sees from one step to the other, from one session to the next, that they really are healing. CBT is a very effective tool that I almost individually use because it really does help a person reframe, reshift the mindfulness, the understanding, the consciousness into this period and into the process of starting to heal. Art therapy is another option, which is non-verbal, as well as music that can be used. But again, all these are very, very nice. The question is how far does it go and how quick does it go into really healing the person on a alternative method kind of a way. At the same time, I try to give the person a system in which he will build a support system with trusted friends, family, or support groups to help them heal. And again, healing is not to fix it. It's not fixing your car in the garage on a Sunday afternoon. Healing is a whole journey that one has to take into consideration not only the feelings, but the nervous system, the vagus nerve within ourselves, to create, first of all, safety, to create supportive interactions. And these are very important. Some we can also use, but not exclusively and not all the way. Mindfulness, physical activity, exercises can help reduce stress hormones, or walking or hiking, creative outlets such as art, writing, music, dancing. These are all good. They help, not all the way, but they do help to help. We have to also prioritize sleeping, healthy eating, relaxation, and remember, healing takes time. And it is unique journey for every single person. It's often helpful to focus on stabilizing the body before delving into processing your memories. We don't only process the memories, but at the same time, we actually reframe them and deal with them and heal the person. Of course, one of the great things we do is treating the inner child. And I don't mind and I don't care how old are you, that inner child is all the way till 5 seconds before your opinion therapy, because it includes all the memories and the way you handled them, which was not professional, of course, through the trauma that you've been through, one or two or a few. And when it is a few, it becomes complex and becomes triggered at every single junction. Hope you enjoyed our short webinar, our Hope podcast for today. Anyone that would like to join into therapy or into a session, is more than welcome to DM me, or even better, to email me at my first name, last name, Gil, Gil, Tivon, Tivon at gmail.com. Gil, T for Tommy, Ivon for Nancy at gmail.com. And I'll be more than happy to see you soon. Have a great Sunday.